Hi, welcome folks. Welcome to Stop LAPD Spying Coalition webinar series, Power Not Paranoia. My name is Hamid Khan. I'm one of the organizers at Stop LAPD Spying Coalition. Super happy to see everybody here join us virtually. I mean, this is something where this would be an in-person regular Tuesday evening meeting for us in our home in Skid Row. But because of the current situations and everything else, we've been using Zoom as a medium, and of course, there's a lot of apprehension and issues with Zoom as well. And we've checked other technologies, but this seems to be the one that is able to reach out to the largest number of audience. We looked at Mumble and we looked at Jitsi and we looked at others as well. So this webinar series, this is a part 13 of our Power Not Paranoia webinar series, and we started doing this in order for us not to be disrupted from our organizing, not to be derailed from our organizing, not to be like some of the stuff that the coalition always does about building knowledge, knowledge exchange, building power, building bases, as a fiercely abolitionist organization with the goal to dismantle the system, as a goal to abolish. And of course, like, for the last couple of weeks, there's been a whole lot of conversation about that. And we would love to continue with that. So quickly, some logistical things. Many of you, when you first joined in, your mics were muted, and unfortunately, they will stay muted for at least for a little while. And the reason is that, there's a bunch of Zoom bombing that's been going on. We've also, one of our webinars about with 2 or 3 webinars ago, there was some infiltrator and they started going into the chat room and posting some pretty obnoxious racist stuff. So in a sense, we'll start off with our folks, with our guests, our panelists as well, for today's discussion on the police state, race, and public health in time of COVID and uprisings. But their mics are going to be unmuted. But in the meantime, please use the chat room. Now, the chat room is also sort of limited too, because that's where we got Zoom bombed, and you will only be able to send messages to the host, which is myself and Shakir, who's the co-host on this one. We'll be able to read that. So if you have any comments or questions for our panelists, feel free to put them in the chat room or raise your hand. There's also that function in there too. And if folks are on the phone who are not in front of the computer, please feel free to text us your question or comments as well. And the number to text that would be 562-230-4578, 562-230-4578. And we'll get right into it. This is being recorded because we're going to be uploading this on our website. And our previous 12 webinars are available on the website. I want to honor and shout out to my comrade Leah Horgan, who's been diligently sort of like posting them on our website so it could be available to our folks as well. So let's get rolling. We are absolutely just excited and honored and super happy to have Professor Dorothy Roberts, who I don't even know if Dorothy needs any introduction at all. And then for our panelists, I'm also super excited to have my other comrades, Professor Bita Amani, who's been on our webinars before. Bita is also Professor of Epidemiology at Charles Drew, and also co-chair of the COVID Task Force on Racism and Equity at UCLA. And of course, our dearest Jamie Garcia, who is who I don't even know, just, it'll take a whole lot of pages to introduce Jamie, who's a registered nurse and also this kick-ass organizer at Stop LAPD Spying Coalition. I'm also joined by co-facilitators, Mina Sharif, who's a postdoc student and doing her postdoc at UCLA as well, and Shakir, who's on our coordinating team. Shakir very doesn't want to identify himself as an attorney, but we're going to out him. So and he's a brother. So well, we got a good group get started. We got about 60 plus folks. So let's get right into it. So Dorothy, this is I don't want to use the word it's an interesting moment, but at least since February or so, what we are seeing increasingly are these right in front of us, staring us, these faces of structural racism and state violence. and structural racism in the context of what the response has been on COVID, and who has been most severely impacted as a result of that too. And of course, we can never have any conversation in the United States without grounding ourselves in race and class and sexual identities and various other things. And then, of course, we saw Tony McDade's murder, we saw Breonna Taylor's murder, we saw George Floyd's murder, and we now these two lynchings that are happening. So, I mean, you've written extensively, you've talked about extensively, your scholarship is phenomenal. So just want to open that with, like, in this moment, where are we at and how do you see this, both in the context of history and our current moment?
Well, I think you're absolutely right that the pandemic made very plain the great chasms in health that have existed in the United States for a long time. I think those of us who have been working to fight racism in the healthcare system and in our society that creates these different vulnerabilities to pandemics weren't surprised. I know that I was talking about this before the statistics came out. It was just expected that when you have a society where already, for example, Black women, an issue I've been working on, Black women are 4 times as likely to die from pregnancy-related causes as white women in the United States. And, I won't go through all the statistics, just about on every type of illness or health outcome, there are really stark gaps in life and death between Black people and other people of color and white people in America, even though, we're now also seeing this really astounding phenomenon that white people's mortality rate is going up as well. And we can talk about the reasons why, but they also have to do with racism and white supremacy. So it's not surprising that when a pandemic hits the United States and the world, and this is something we're seeing around the world, that Black people would be hit the hardest because Black people in America already are more likely to have poorer health because of structural racism, because of the living conditions in segregated neighborhoods, exposure to toxins, exposure to the stress of racism. And here's something that ties together the various crises that we're seeing: exposure to being incarcerated, to spending periods of your life in jails and prisons, and having family members who have the stress of police violence in your neighborhood. And again, I'm happy to go into more detail about all of these, but it's to be expected that people who have experienced those kinds of assaults to their health, and I haven't even mentioned access to healthcare, the grave inequalities in access to high quality healthcare, lack of universal healthcare in the United States, and then during the pandemic, having jobs that expose you, to infection. And in the United States, we have a very gender and race segregated workforce with women and Black, Latinx, and immigrant and Indigenous people primarily, but also then intersecting with what's considered women's work, being at even greater risk of infection, and on top of that, not having the protections and being forced to work because of the racial capitalist system we have that forces people into low-wage, unprotected work. I think I've mentioned, maybe 10 aspects of U.S. white supremacy and racial capitalism that all converge to put Black people in America in already a poorer state of health. Then you add in these exposures. And so it's not surprising that you're going to see these really astounding, striking differences in rates of infection and death in the United States coming out of the pandemic, and appearing, as soon as they started keeping statistics, these gaps start being revealed, and then more and more and more. I have to say, what I found, I shouldn't have found it surprising, but what is shocking. Now, of course, it's appalling that we see these high rates of infection and death in Black communities, but also, but as I said, to be expected given the conditions in this country. But what's equally appalling and shocking is the explanations that started to be circulating, that were based on what I say is sort of the question that is asked throughout the dominant research in the United States: what's wrong with Black people? So, what is it? The question was framed: what is it about Black people that predisposes them to infection and death, as if there's something innate in us? And again, I can talk about, that relates a lot to the research and writing and activism I've been doing around the biological concept of race. And this is a constant theme of medicine and biomedical research and science generally really in the Western world. It began in Europe, but was really perfected in the United States. The idea that people of different races have different diseases and experience common diseases and pandemics differently because of some kind of innate pathology or lack of pathology in their bodies. And so you started to see these explanations, even in scientific journals. So this wasn't just, there's these kooky ideas that some politicians have. One the other day talked about, maybe Black people don't wash their hands as well as other people, which if you know anything about Black people's culture, we're like sticklers for washing our hands and bathing and all of that. I mean, what I also think is, well, I wouldn't be surprised if he had a Black person or another person of color cleaning his house, but so that was one idea. But even people who are supposed to be, have advanced scientific knowledge, asserting that maybe there was some kind of innate genetic or other kind of biological susceptibility that Black people have to infection, and that's the reason for these differences. Or some also then point to some kind of cultural defect besides not washing your hands, but the being obese or having diabetes or not following the protocols, instead of looking to what we already know are these structural vulnerabilities caused by racism and white supremacy that we know exist already. There's lots of research on it. There's lots of experience. People, I mean, you can just look around and see these forces of racism that produce these different outcomes that people are claiming to be biologically based, in other words, innately based in certain races. And so that's that long lasting argument about, is it something innate in Black people that predisposes them to all sorts of bad outcomes, or is it the much more plausible and well-established answer that it has to do with structural racism and white supremacy and racial capitalism? So that was, it came out front and center during, well, still during the COVID pandemic. And then, I mean, I can stop there if you want to explore any of those things, but that's the kind of, that's the kind of conflict going on around the really horrifying rates of death, which also were based on the way in which America deals with just human needs in general, and through a purely profit-based system that doesn't provide the the human right to health care. And we could, that way of caring for people or not caring for people, it has always meshed with white supremacy and racism in the United States in lots of different ways. I mean, ideologically, in just the way in which a majority of white people do not support policies like, that would provide for everybody, in part because they have an investment in making sure that people of color don't get that. And so in that way as well. And
that's where I was going to go with as a build up to that, because one of the things at the Stop LAPD Spine Coalition we say is that the function of police and the purpose of the police for communities of color, particularly the Black and Indigenous community, is the intent to cause harm. So it is the intentionality that it's not about public safety. It's not even like the thought about safety or service. It is with a clear intent to cause harm, and how that harm is caused. So I think in that, going back to the comment that you were making about the biological category, I think it'll be very instructive for us to explore that a little bit more with you, because that your scholarship you've discussed extensively that how race being a political category which has been disguised as a biological one, right? So talk about that a little bit. That in that history of science and medicine, how does that intersect with surveillance, race, criminalization, and all of that?
Yeah, well, I have worked on a number of different kinds of scholarly and activist projects. My very first work had to do with opposing prosecutions of Black women who were charged with various crimes because they used drugs while they were pregnant. And I've also worked on the racism in our foster care, and what I'm calling and others are calling a family regulation system, or a foster industrial complex. And my most recent project, although I've been working on all these things, continue to work on them, but my most recent research project was on the resurgence of biological concepts of race. And part of the reason why I decided to work on that and write a book about it was, first of all, I saw that there were more and more scientific studies that were looking for genetic differences between races which I just thought was kind of strange because I thought that it was pretty clear that there weren't genetically distinct races. I thought that had been proven, and we were done with that. But no, I saw right after the human genome was that more and more research being done on that, and more of an acceptance of this idea that the reason for things like health disparities and inequities, but also other inequalities that clearly come from structural political factors were actually caused by differences in genes. And so I was, really alarmed by that. But as I looked at it and as I thought about all of these issues, I see more and more how this fundamental notion that human beings are naturally divided into races was produced by racism to support racism, and specifically enslavement of African people and conquest and extermination of and control of Native peoples, and all the other oppression that has occurred in the United States. And but originally, the concept of race came out of Europeans' desire to conquer and take the property of and enslave other people. And that's the origin of it. And you can trace throughout US history the way in which that idea that human beings are naturally divided into races has been used to justify white supremacist racial order in the United States, and to make it seem as if that's a natural order. That basically is what white supremacy is. The claim that white people are superior and have an entitlement to dominate. White privilege and the investment in whiteness is all about this idea that white people are destined. They even if they don't say it, like, it comes out. You could just, it comes out in so many ways. This idea that white people are naturally destined to dominate all other people, and that they have a right to do it. They have an investment in it. They can use whatever power they need to do it. They can be as violent as they need to be to keep that control and that position, and then to make it seem as if it's not really violence. It's not really bigotry. It's not really racism. But if it isn't, why? Because of this idea that it's natural. And that, and this goes back to what I was saying about COVID-19, the idea that, Black people are dying at higher rates, not because white people have done anything to create an unequal structure. It's just natural. It's in their bodies. And people say that about mass incarceration. They say that about police violence. I mean, just think about even like Rayshard Brooks, who was shot in the back by police in Atlanta a few days ago. And the kinds of justifications for it. Well, he was drunk. He was blocking. Even I was on MSNBC yesterday talking about. I was saying this is a perfect illustration of why we need to defund police, because if they didn't need to be there at all. The man was sleeping. They didn't need to be there. If they weren't there at all, I'm not just talking about they shouldn't have shot him in the back. Of course, right. They shouldn't have shot him in the back. He was running away. They shouldn't have even been there. Because as you said, Hamid, their job is to be violent. So if they show up, you are at risk. They're going to beat you up, tase you, or kill you.
Yep.
Right? So because that threat is always there. That's where their power comes from. And that's what their role is, to threaten to kill. That's why they're armed. No matter what they're doing, they're coming to move a sleeping man, and they come armed and end up killing him. Why? How did we get there? I'll tell you, though, so many people angry emailed me. You said he was sleeping. He wasn't just sleeping. He was blocking the line. Oh, and that makes a difference? I'm sorry I didn't mention that. I didn't think that that was a justification for killing somebody because they're blocking a line at ways. But how do people even form their thoughts to think that way? You know, because and why don't they see that if that was their husband, their child, you know, their partner, it would never occur to them that you would need an armed force to move that person and help that person get home. But racism, it is the ideology that there is an entitlement to that privilege of feeling that you're safe and secure, but that people of color don't have the right to feel that way. And so, but to get back to your question, it all, I think, fundamentally comes back down to this idea of a natural division of races, which was purely invented in order to support racism, but it's so embedded in so many people's minds that then they're able to believe these myths about Black criminality as if it were a natural trait of Black people. So it doesn't matter what a Black person is doing. It can be, police violence against them can be justified, you know, seemingly justified, because they're supposed to be innately prone to crime. There was a white woman emailed me, again, angry, she wrote, I support Black Lives Matter because George Floyd was a blameless victim, but Rayshard Brooks wasn't. And then she said, you're going to lose white allies with your arguments, you know, as if only so-called blameless Black Lives Matter. But she decided to paint George Floyd as blameless. Other people, you know, have said he wasn't blameless because he allegedly was trying to use a counterfeit $20 bill. In some people's minds, that justified what happened to him. It's easy for many people, because of racism, to justify any kind of violence against Black people because they see Black people, and this has been promoted for centuries in the United States, as naturally prone to crime. So what, you know, any Black person might commit a crime. And this is something I think that is true of the prison industrial complex in the United States and the role of police in the United States. As you said, the role of police, when it is not to make people safe, it's to enforce an unjust racial order. Absolutely. And it always has been from the time of slave patrol. And that has been supported by this idea that Black people are naturally prone to crime. And so controlling Black people in the name of law enforcement doesn't require the Black person who's being controlled to do anything. That's why you can look at the whole history of law enforcement in the United States and see that many Black people have been killed in the name of security for white people who never did anything. You know, lynching was not based on any actual need to prove a Black person's guilt. Overseers during the time of slavery didn't have to prove that an enslaved person was guilty of anything in order to beat them or even kill them. I mean,
Mm-hmm.
the crime was not being subservient enough.
Mm-hmm.
You know, and the
And it's
same
also,
thing with, yeah.
yeah, and it's also very interesting that which brings me to another sort of a guiding value that drives the Stop LAPD Spying Coalition's work. I mean, the first one, not a moment in time, but a continuation of history, but the constant creation of the other.
Mm-hmm.
And how in the history of the United States, how politically, economically, culturally, socially, these faces have been paraded
Mm-hmm.
to create that justification for violence, and how they have been sort of articulated, how they have been framed, and we talk about like the face of the savage native,
Yeah.
the face of the criminal Black, the face of the illegal Latino, the face of the
Mm-hmm.
manipulative Asian, the face
Mm-hmm.
of the terrorist Muslim, the face of the deviant trans. So
Mm-hmm.
all of these bodies and all of these identities have been very, very methodically, and it's not just the law enforcement, it's like from so many different ways that, and it's not only about not white, not quite, it's also within people of color, and
Mm-hmm.
as a way that, in a sense, that as non-white, non-Black people, I always talk about the South Asian community and other folks who are brown and everything else, that we all suffer from a disease, and
Mm-hmm.
our orientation has been the disease, that the assumption of privilege of not being Black. I mean,
Yes.
that's how deep this runs. So I'm going to invite my co-facilitators Mina and Shakir to see if they have any questions. So I'm going to unmute you, Mina and Shakir. So go ahead and unmute yourself too. So go ahead, Mina.
Oh, sure. Um, so this is kind of related to a few of the topics you've brought up, but so within the current context, a lot of researchers and policymakers are pushing for more data disaggregated by race and ethnicity in terms of COVID-related outcomes. But there's also the increasing concern on hypersurveillance and tracing that will undoubtedly take place predominantly in communities of color, especially how the role and presence of law enforcement has since expanded within the COVID context, and they're even at testing sites. So what are your thoughts on this, and what additional data do you think are needed, and how best do you think they should be obtained to not only inform advocacy efforts in the spirit of health equity and social justice, but also to make sure that they don't do more harm?
Yeah, yeah. That's a really good question. And I think it always helps to have some principles that we can follow to figure out what's going to push us toward our goals and our visions, and what isn't. Just as an aside, and then I will answer your question, but I think, for example, there's just so many questions, when you're talking about abolishing the prison industrial complex, and you have a vision of the society that we're trying to create. It's incremental. So you have to ask, well, what strategy is going to get us there, and what strategies will take us backward, or even reinforce the very kinds of regimes that we're trying to dismantle. And so I think it's so helpful to have principles that people have discovered through, or developed, through organizing, to know this is the kind of thing that works and this doesn't, with our values also being part of it. And so just a couple things as we think about, well, what kind of data is harmful and what kind is helpful. One thing to think about is the principle that we want to always make sure we are taking money and resources and power away from the police and prisons and not giving them more money, power, and resources. And critical resistance also adds, and not supporting the idea that police make us safe. And I think it's just so helpful to have that as a principle, to evaluate strategies by. Not that it's always easy to do it, but it's a good principle to have. I just wrote a piece that came out in the Chronicle of Social Change today about not just to be cautious about, but not to promote the idea that funds and power and authority should be transferred from the police to child protective services, because child protective services is a form of policing, and giving them more power and money is only going to expand the surveillance and destruction of families, especially Black and Indigenous families in the United States. And so, while we should be defunding police, we also have to think about the principle of not giving more power and money to another destructive surveillance arm of the state. Another principle that might be helpful that I often say in my work on race-based medicine and against race-based medicine and other aspects of public health is to think about what race means. So I often get questions about, well, should we use race? It's kind of related to your question, from medical students and doctors and other healthcare workers. Should we use race at all? You're saying that race is not a biological category. It's developed to support racism. It has had all these harmful outcomes, ideological and material. So should we just not use race at all? And I always say, well, it depends on what you're using it for, and importantly, that you're using it to mean what it actually is. So, do not use race as if it were a biological category, because it isn't. Yes, if you are using race, and the only reason I think it's valuable to use the concept of race is to attack racism, to expose it and attack it. This is the only reason. And to use it that way, you must be using it as the political category that it actually is. Race is real. It's not, saying that it's not a biological category, that it's not innate, that there's no natural division of human beings into races, doesn't mean that there isn't such a thing as race, which is a political invention that was created and continually is made to look as if it were natural. And, it is confusing. I do know some people who say, well, I know someone who's a geneticist who studies zoology, she said, no, in zoological terms, a race is a genetic grouping. So if you're going to use it, it has to mean that. And so you just should not use it at all for human beings, except that we do use it all the time, but when we use it, we are using it as a political grouping. And it's just that there's been hundreds of years of this pretense that it's natural when it isn't. But that pretense was deliberately for political reasons. Okay, so now if we think about those things, what do we do about racial data? And I do think I think we want to know who is dying at the highest rates from COVID to help us do something about it. I think we do want to know that. We do want to know who the police are killing. we do want to know who they're racially profiling. And so I do think that data that show that, but again, we're using that data to understand structural racism, and we are identifying people according, we're acknowledging that we're identifying them as being part of a social grouping that is treated a certain way and has certain vulnerabilities because of that social grouping, not because of something biological innate in them. And so that's one way to think about whether the data is helpful or not. Another thing about these proposals for contact tracing and other ways of monitoring the pandemic is, which might include, some of them do include artificial intelligence, predictive analytics. There, I think we have to be very vigilant about the way in which predictive analytics in particular has always been shaped by race. I mean, I wrote a piece about predictive analytics where I said that race itself is a kind of predictive analytical category, because it's the whole idea of race is we can divide people into these groups and predict what they're going to do because of their innate qualities. That's the idea of race, that we can predict that this person is going to be a criminal because of their race. But again, it's a disguise of the violence that the society has structured against them by saying, well, it's natural that these bad things are happening to them. But race itself and the whole history of race in the United States is all about predictions. Eugenics was about predictions about people based on their race, a prediction that their children would be drunkards and feeble-minded and welfare dependents and unintelligent. That's why you had states around the country mandating that they be sterilized based on this idea, which was dominant science in the United States. I could go down so many horrific policies that are grounded in biological concepts of race that are based on predictions that are made because of race, that are actually not because of any innate trait. The reason you can predict it is the same reason that I could predict that Black people were going to die at higher rates from COVID-19. Not because of some innate trait, but because of the structure of our society that predisposes people to these bad outcomes or better outcomes. So prediction and race and racism have always been really deeply entangled. Now, let me just say a couple more things about predictive analytics and surveillance, which is something that matters a lot, is who has control of it. One thing, in thinking and writing and engaging with people about it, I just ended up thinking there's only so much you can do to fix the algorithm. There's all these ideas, well, we'll take bias out of the algorithm. And I should mention first, perhaps before making this point, that these algorithms are biased because the data that goes into them are already biased by past inequalities. So in law enforcement, it's, I think, one of the most obvious examples that if you design an algorithm to predict who's going to commit a crime in the future, and you put into it data, or you run it through data that was collected based on racist arrests and prosecutions and incarceration, okay, of course, it's going to predict just a replication of the past inequality and injustice. And then also you could put into the algorithm factors that aren't explicitly about race, but if they track the outcomes that are produced by structural racism, the racism is embedded in it. So the idea that that these are objective is absurd. It's nonsensical. They are filled with bias because of the way in which past inequality is embedded and built into them. But then, you've got the programmers who say, okay, we can account for that. We'll just build an algorithm that says, well, there's already this much inequality, and so we'll add something to the algorithm to account for that. One thing that's important is if the person developing the algorithm is not aware of all the types of inequality and doesn't put them all in it. It's just like researchers, biomedical researchers, who say, well, we're going to control for all these social factors, and then if we see a racial outcome, it must be because of genes. But they don't control for all the social factors that Black people or other people of color experience that affect their health. And so the conclusion, it's because of their genes, is just a false conclusion. And similarly, if you say I'm going to build a fair, colorblind algorithm, but you don't take out all of the injustices because you just don't know about it.
And it's also something at the coalition we've been I'm glad that we're having this conversation, because this has been a major issue, because we also have been having, as data abolitionists as well, because the way data gets weaponized, the way data gets is political, the impact of data, and even looking at the algorithms as well, because we were in a major fight against predictive policing, and all power to all people, we were able to dismantle predictive policing in LA, that it's not even mathematically possible to have an unbiased algorithm because of so I think even to go down that route is almost like a fool's paradise, that no, because, and we use our own examples as well, like how many different ways do you want me to tell you that within the white gaze I'm always dirty data?
Exactly.
So that's not going to change if yeah. So
yes, exactly. That's kind of where I was going, is that there are all these impediments to even if hypothetically you could create an objective algorithm, there are all these reasons why you would never get there. But by the point I'm building up to is that if you have an algorithm or some kind of surveillance system or predictive analytical system that is designed to serve the purpose of incarcerating people or denying benefits to people or denying health care to people or devaluing people in some way, denying some human right to people, if that's what it's for, it's going to do that. And so that's also an important part of it. Like, what is this for? And who's in control of it? So there's no way you're going to convince me that the LAPD is going to be able to work with, and of course they don't do it, some private company, that does it, but is going to design a surveillance system that is not going to harm Black people and other people and people of color, because that's what the LAPD does. They're not going to do that. So I am not going to be convinced that first of all, I don't think you can do it, but you're not going to convince me that you have done it, because I know the purpose for which you want to use it.
Right.
And so on all those grounds, I think that we have to oppose these surveillance systems.
Absolutely. And that's where
Yeah.
the abolition, we got to abolish them, that there's no way to reform them. Let me just open it up
Yes,
to
I
see
agree
if,
with you. I didn't know that was your position, but
absolutely, total,
I should have
complete
done more
abolition.
research before I came on here. But I absolutely agree with you. I think that's true. That's true. It's just
Absolutely.
similar to why we have to abolish the prison industrial complex, including police, because that's what they're designed. They're designed.
They will remain flawed by design. Absolutely.
Yeah, exactly.
Shakir, I'm going to unmute you, and then Jamie, I know we're going to go over there. So go ahead, Shakir. You wanted to ask a question?
Sure, yeah, thank you. And by the way, I love Professor Roberts, this like kind of comparison between thinking about these like predictive policing tools and risk assessment tools as like in the lineage of eugenics, and like all as like
Oh,
that
yes.
also kind of predictive. I've never really thought of that. That's really powerful. So my question, we've been talking a lot about the health system and the responsibilities and role of the health system. I want to ask about the legal system. That, so much of what we're fighting, so much of what makes these things unjust, these systems is kind of fully legal and was designed by lawyers, and not just designed, but then over time reformed and reshaped and constantly reimagined by lawyers. And lawyers who have this kind of monopoly of expertise on the system. I know you talk about this a little bit in the Harvard Law Review Forward last year, but about the relationship between constitutional law and abolition. But just can you share about like how do we use legal tools as tools to dismantle the system, and how do we do that without kind of reproducing those hierarchies and reproducing the system's oppression, even when these tools are useful?
Yeah, well, that's a big question. That's a very big question. Yeah, critical race scholars have been pointing out, for what is it, like 30 years now, how racism is embedded in the law, in legal standards, in legal institutions, in legal systems, in Supreme Court precedents. And, that was something I laid out in that article, that the US Supreme Court has been anti-abolitionist from right after those amendments were passed by Congress in right after the Civil War ended. And it is very hard to practice law within the US legal system for abolitionist ends. It's extremely hard. There's so many ways in which you're forced into situations where it is not clear at all if you're harming or helping people. And I think, though, that, just as I was saying about abolitionist strategies and the idea of non-reformist reforms, making incremental changes that move us toward abolition, that we can use the law in that way. Now, using the law means lots of different things. It can mean bringing a lawsuit. It can mean charging someone with a crime and convicting them of a crime. And when I say lawsuit, I mean a civil lawsuit. It could mean bringing a civil rights action. It can mean passing an ordinance. I think about the Chicago Reparations Ordinance. that was law passed by the Chicago City Council, that all the abolitionists I know see it as a victory. But that was using law. I mean, they will point out, we did not call for the prosecution and conviction of those police officers. We did not go into court. But going to the Chicago City Council to get a law passed is using law, right? I mean, that's law. Getting a city to stop money bail is using the law. Whatever you have to do to free someone from prison, you're probably going to use a legal tool to do that, and argue and in some legal setting. There's also a history of people using the law to make a point, even if they know they're not going to win. And in fact, you often have to make a point that you know isn't going to win in order to contest the system. And so, you know, I think about various members of the Black Panther Party who appeared in courts and called out the hypocrisy of the courts. Now, they were forced into court, but they used it as a forum, you know, to call out the injustices of the U.S. supposedly justice system. So there are victories that have been won in courts, in legislatures, but it's very difficult. I have to say, I have found that where I have tried to participate at all in getting legislation passed, it's just been so frustrating because you have to negotiate with people who do not see things the way you do. And I've been in battles over that. I remember once under the Obama administration, there was the idea of funding visiting nurses to visit people who had just, who had newborns at home, which, sounds, again, like I said before, it depends on who has control. Sounds good, in a society we might create, but part of the legislation was that whoever got the grant had to prove that they had reduced the childbirths among the people that they were visiting, and that they had reduced and the arrests, and there were just all these restrictions on the agencies that would get money for this program that really then gave the visiting nurses or social workers incentives to try to control the reproductive decisions of the people that they were visiting. And I and Wendy Mink wrote something against it. Oh my goodness. The liberal, these were people who were, I don't want to say Obama was directly, it was part of the Obama administration, but people who were Obama, in the Obama camp, liberal people who saw this as a way of getting a huge grant through this legislation were so angry at us for raising any criticism. And what they said to us was, look, we had to negotiate with Republicans to get this act passed and this money out of Congress. And Republicans aren't going to support a visiting nurse program if it doesn't include their agenda, which is to reduce welfare.
Absolutely.
You know, so to me, I don't like to judge people's motivations or anything, but all I can say is I could not participate in something like that. And I felt like,
but I think it's also, it needs to be stated too. And thank you, Dorothy, for saying that, because, I mean, this is how we have to. I mean, for example, at the coalition, we have a very, very strong position about passing any transparency or oversight or regulatory ordinances on surveillance. Like, we have exposed the ACLU for backdoor negotiation and taken away the power from the people and selling out people publicly. But the ACLU, we have, like, there was so many instances. Somebody just made a comment just now in the chat that liberals are the worst types of conservatives. So I think that is something, because, that's where there is. So now I'm just going to open it up and bring Bita and Jamie into the conversation as well. And Bita and Jamie, I'm just going to unmute you. So Jamie, you may want to unmute yourself as well. Go ahead and give it a shot. So and I'm going to also invite Mina and Shakir. So getting it started, like, there's Dorothy has laid out such an intense and an immense landscape of for us to really kind of just dive in and build from, and also, like, how do we incorporate that into our organizing and in our thinking, and what kind of narratives are we building? So go ahead, Bita. I mean, where do you find us in this moment?
I mean, I think, there were so many things you said, and looking back, I should have probably taken these notes in a more organized way versus
okay.
down and putting major boxes about them. But I think right now in the conversation on abolition, there's, and I mean this more like generally, right? Like, we're talking about things that are like dominant, right? That that there's a more of an awakening to, like, why would you use harm to correct a harm?
Mm-hmm.
How does that make sense? And I know that, everything you're saying here points us to how we've naturalized and normalized that because we accepted that first normalization and naturalization of life being differently valued, right? And so then when you think through that, then, Shakir's question on the legal system, I could have just taken out legal and put health, right? Like, we literally could have, like, substituted the word, because so much of, your scholarship has also shown the role of the health sciences and creating this normalization and creating this naturalization. And, people have had to, like, be very diligent on challenging that COVID dominant narrative of, like, biological determinism, like, coming through. But because it's happened, and because we have these histories, and we can keep going back, and it can be eugenics, and then it can be like skull measurement, like, we can just keep going
yes.
back, right? And we can find, like, the dominant example of the time of who's working to create these sciences and all this. Because you have laid out how it operates on the civilization. What is the healthcare system then today? What is the public health system then, as a system that also we can point to examples of where it thinks that harm can be used to correct a harm or to right a harm within it? And all your examples around DCFS, like, that's us at play too. The programs in the hospitals of separating babies from their mothers because of whatever thing you put to say that you think that they have used drugs or whatever all that is, that right there is a public health solution, right? Like, technically, to say that I should take your baby away from you because I believe, all these things about you, and I'm judging your ability to care for your child at this moment in these ways. And you see this happening in real time right now with the COVID pandemic, in the stories that are coming out about Native women right now in active opioid drug programs, and I think it's Albuquerque, having their babies taken away, despite all the evidence and all the advocacy and all your work, that was like, why are you doing this? Look at this disparity, look at it. And so then in the abolition part of it all, like holding it, and then, you know, we might be able to become more critical of policing and incarceration and say, hey, like, that's not how we want to do this. A non-reformist reform is then also saying, like, these people over here have a version of care that I think we should really question as well. The care systems have a version of care that we should question. So I really want to hear what your thoughts are to those of us right now wanting to think through these complex issues of being in support, in solidarity, but also looking at our own home and being like, this place needs to fix itself really quick.
Yeah, well, you said a lot there too. Just to pick up on your point about a harm, correcting a harm, supposedly being able to correct a harm, that just evokes lots and lots of thoughts that I have on what we've been talking about. One is the way in which, and this relates to what Hamid was saying about creating the other, and then it seems justifiable to do all sorts of violence to that person or that group, even, and this is what's really sickening about the way in which racism and white supremacy work, is that you can even make it seem as if you're doing it for their good. That's why it's possible to inflict so much violence on people and make it seem justifiable, is partly because there's the veneer that it's actually for their good. This is what, for example, Justice Oliver Wendell Holmes said in Buck v. Bell, the US Supreme Court case that upheld eugenic sterilization. And he held that it was constitutional because it was for the benefit of Carrie Buck to sterilize her, because then she wouldn't give birth to a child that was going to starve to death or be a criminal, because they had, you know, they were inherently going to be feeble-minded. And so he could make it seem as if I, US Supreme Court Justice, am ruling something beneficial, when in fact, what they had done was forcibly perform a surgery on her against her will that would prevent her from having children. Like, that's a really serious harm. A extremely serious harm. And yet he's able to paint it as if it's a benefit. One of the examples of this that I think is, you know, really at the root of racism in US medicine is Samuel Cartwright, who was trained at University of Pennsylvania and went back to the South. By the way, University of Pennsylvania trained mostly Southern doctors, and the key pillars of racist medicine all went through University of Pennsylvania. But he went back to the South and wrote a treatise on the peculiar diseases of the Negro. Some of you may have heard of his work, but his main theory was that Black people had lower lung capacity and therefore had to be forced to work to be healthy. So he created this idea that slavery was good for Black people's health because it improved their lung capacity. And that idea continues to this day in medicine. In fact, I mean, it literally continues to this day, that there still is this idea that Black people have lower lung capacity than white people. And it comes out in all sorts of tests and conclusions about Black people's health and ways of disadvantaging Black people based on that theory. And I could give you lots of other examples just like that. But it's such a powerful idea to whitewash away and obscure violent racism, like we're talking about the most violent acts as if they were good for the people they're inflicted on. And public health has been a major part of this. Again, going back to something you said, Hamid, about the other, in public health, the idea that certain groups are a threat to the health of the nation. And you could look at just about every marginalized group in the United States at some point has been considered a threat. And that has been a justification for imposing the most brutal kinds of state violence against them for the sake of saving the health of the nation. You were mentioning the separation of Native women and their children, supposedly for the benefit of them. That was the same thing they said with removing newborns from Black mothers who tested positive for drugs. This is for the good of the child. That's what the whole foster care system is about. This is for the good. This is a benevolent system that's helping these children, when in fact it's causing them trauma and their outcomes are terrible. And I believe that foster care not only inflicts harm, but it makes children vulnerable to all sorts of kinds of structural violences, like being put in juvenile detention and being incarcerated, and being homeless, and lots of other outcomes like that. So yes, there is a lot of causing harm to people to solve a harm, but the reason why it seems acceptable is because those people are, number one, deemed as innately distinct, in this fundamental way that race creates, innately distinct, but also that this is for their own good, which means that you're saying those people don't know what's good for them. And in fact, going back to Cartwright, he also invented this supposed diagnosis of Black people who escaped plantations, that they had a mental disorder. So the idea that when people rise up against oppression, they're harming themselves. This is, and they need control in order for them to be good citizens or to be healthy, or to survive. That is a powerful lie that is very much entangled with race and racism, that has been used for centuries, and is very effective, not on the people who are being victimized and surviving it. It's to convince the broader public that these policies and practices are justifiable.
Wow. Jamie, I'm going to go to you, and as we are also having this conversation, but also would like for you to talk about the current moment as well from your vantage point, and how do you see this? Because both as a frontline healthcare care provider, and also as an organizer, and yeah. So just take it away from there.
Yeah, this conversation has been absolutely amazing. I was part of the group that facilitated the dismantling of the 2 predictive policing programs in Los Angeles. So we've done a lot of thinking around data, around algorithms, and created this beautiful tool that we'd love to share with you called the Algorithmic Ecology, that really decenters the algorithm and kind of brings in all the actors and players that actually utilize and manipulate and kind of make this whole subjective land that they're trying to hide behind science. So just been truly enjoying this conversation. So I want to bring us now, down to the ground and kind of share a little bit of, being a healthcare worker, and so much that's being said is so many ways that I experience on a regular basis in the hospital with the implicit, the racism, the innate racism that I hear and I see, and the way that medicine moves, how to guard against that as a frontline worker, how to have to, you know, call it out when you're in the middle of a bunch of stress, but you're like, this moment has to just be exposed right now. So in saying that, I think my concern right now is, you know, just today I visited the hospital for another reason and was able to talk to the nurses. And a lot of people know that I organize. I am on a unit that's a non-COVID unit. It's an oncology unit. It's mixed with patients that that are, you know, already in the hospital for various reasons, but also we have cancer patients as well. So there was a moment where I had to make a decision whether or not I was going to be on the streets anymore. I was there in the surge of the moment with people, got tested and was thankful that I was negative, and I had to come to the conclusion that my situation, and everybody's situation is very independent, speaks to something a little bit different, where more people are, I'm accountable to more people. So in saying that, I kind of wanted to talk a little bit about the reality that we're experiencing right now in LA, that we are in the middle of a surge. And the surge is not because of the protests, and I want to say that right now. At this moment, it is not. You know, the surge is coming because of Memorial Day, because the beaches got opened, because everybody came together and started celebrating in the fashions that I'm sure a lot of people are seeing right now. I stay out in Long Beach, and the brunches are happening on the decks, the shops are open and people are mingling, the beaches, which is amazing, because I was having this conversation with folks about how I almost felt safer in the protest because everybody had a mask on, as opposed to going for a run at the beach where nobody had a mask on at all. And so the differences are very apparent. The conscientious protester being out there with the mask on is very apparent. The kind of material driven, I want to get back to normal mentality is very apparent because the masks aren't there. The deciding I want my right to be not masked. So my question comes, how do we now, when the moment is going to start happening where we're going to become a part of the narrative, the protesters, the resistors, the freedom fighters, the people who are putting their lives on the line for to dismantle structural racism, to abolish policing, to take that into their hands and actually be very present. How do we start to not only take accountability for if we become sick, if we decide to get tested, we are positive, right? Mayor Garcetti right now is sending out tweets saying, don't be concerned to answer a phone call from LA County Public Health. We will not call ICE, but we need to speak to you, right? So how do we start to guard ourselves? Because maybe we would like to think they say that. LAPD says they don't work with ICE, but we know through the information sharing environment that we call the stalker state, that relationship is very present. So how do we start to guard against ourselves? How do we start to take accountability, not only for if we are sick, if we are positive, but how do we do our own? And we said this in our working group with folks that are here that are working on this kind of idea around surveillance and COVID-19, but how do we do our own contact tracing? How do we do our own picking up the phone and letting our people know? But then also, I think lastly, is how do we take control of the narrative? Because we have to be sure that it's not just us that they want to start to blame things on, which they will do, because just as you were saying before, it's like they're going to use the data how seems fit. They're going to create categories amongst us, right? And so how do we get ahead of that, and how do we start to kind of demonstrate that it's actually, like, you know, the capitalistic system that is contributing to this surge more than anything else. So I know that was kind of a lot, but it's definitely on my mind. The nurses are asking me, and they're like, what do we do? And yeah, so if you could speak a little to that, that'd be great.
And just real quickly, before Dorothy, you go, I just want to invite other folks that please feel free to post your questions in the chat room. And we can continue with the conversation. And also we got a good still 35, 36 minutes. And if you're on the phone, you can also text it to 562-230-4578. Thank you. Go ahead, Dorothy. Sorry for that.
Yeah, well, I almost feel like throwing the question back at you because you've thought about it a lot. And I think the way you're framing it is really right. So I think, there's in abolitionist work, there's both thinking about what we want to demand that the state do or not do, but there's also a recognition that we have to do a lot of it ourselves, and not only because the state isn't providing for human needs or protection, and but also because we're trying to figure out and create completely different ways of solving these problems, and providing for people. And so I really like your idea of, okay, we know the problems of surveillance that are probably going to be in contact tracing. So how do we figure out ways to be safe and not to harm others, on our own? It's like a form of mutual aid or a care network. I guess because I don't know, again, a whole lot more about the health, the details of how this works in terms of health than I do. So I'm not sure exactly if I could offer any advice at all about the details of it, but I can say that that sounds like a really important way of thinking about how to move forward. And so I think also, the idea of dismantling and creating at the same time, I think is such an important part of abolition work. So, and as I said, it's both because of an immediate need, like during the pandemic. I sometimes I don't know why I'm talking about it as if it's past. I think it's just because we've been thinking about other things. Exactly. But the need to provide food and sustenance and other material needs that people have, because so many people are out of work or are at home and don't have connections with people they need to care for them. So there was just an immediate need to figure out within communities how to provide for that. But at the same time, by doing that, you are also not only developing a model for it, but actually creating it, creating that future. And I think that, and what I'm saying now is, it's just what you, Jamie, inspired me to think about just now. But I think, when you said, how do we frame it, the narrative, how do we make the narrative so it's not the state's punitive narrative or surveillance narrative, but it seems like creating these networks or these ways of sharing information and keeping each other safe, it actually helps to create a narrative itself, And so I think that's part of it. Just, again, I can't, I have nothing to, and no help to give about how to do it. But I think if you start to work on doing it, you're actually, you're creating the narrative as you're doing it. And getting the word out there that that's what you're doing, so people know about it, is a way of doing it. Now, I don't know, the lawyer or ex-lawyer in me is saying, well, I don't know what the legal issues are with, if there's some kind of mandated contact tracing. But I think that's what, that's the part you're working on, preventing or dismantling as you're doing this other way of just caring for each other.
Yeah,
Could
Richard.
you, if I, hold on one second. Is it okay, Hamid, that I just?
Yeah. Please,
Okay,
please,
could you
please.
speak maybe a little bit to that component, just as from a legal perspective? And this was something that we also talked about, like the phone rings, you're positive, you pick it up by accident, or you maybe choose not to, it keeps ringing for you to, like, day in, day out. What would you say are our know your rights when it would come in the framework of that, of this contact tracer trying to get a hold of you?
Yeah, well, this, Shakir, here's where you see it's important to know the law. I mean, back to what I was saying was, my discussion with Shakir. Yeah, the law, there's so many ways in which you can get co-opted by it. It ends up being very conservative, almost inevitably, but it does provide tools to challenge oppressive acts by the state. I mean, it's not always just a performance. Like, sometimes you might actually be able to prevent some, oppressive policy from being enacted. And, or as we're talking about now, just letting people know what their rights are, representing people who are contesting these policies. Again, see that all of a sudden I feel like I have so little expertise in what you're asking me, but and this is what lawyers always say. Well, I suggest you get a lawyer.
Well, the one reason
that question.
The one reason I do bring it up is because in Minneapolis, their public safety, I don't know if it's an officer, started to say they were going to use contact tracing in the jails as for the arrestees to trace to see if there was criminal elements or criminal activity amongst those who were arrested. Yeah. So in some senses, and it's not to say that I believe that Garcetti is going to try to figure us all out, but just wondering, just, I guess it's the question on the mind, and I appreciate just how we can, and this is just my pitch as a nurse, how we can take that responsibility into our own hands as well, and how it's when we think about mutual aid and we think about caring for each other and creating a new world like this, exactly as you said, these are the steps in how we do that and how we are accountable to each other.
I absolutely agree. I think that's so important, and I also think that this requires, people who dedicated lawyers and legal research or researchers who can think through what your rights are in this. It's just not my area. I can tell you though that if the city passes a law or it imposes a policy that at all coercively is trying to extract information from people, that raises legal issues. I just don't know what part of it depends on the legal basis for the policy in the first place. And
so I think maybe as we are having this discussion around alternative frameworks, I think that's what we are sort of kind of just gliding into. You know, just and I think that's something so we need to have this conversation as this is moving. But you know, just a comment just was made about, like, you know, the role of PTAs and church groups, you know, just engaging in their own local communities and what sort of spaces that can be created in those community relationships and what have you. But so I just want to go to that, and also just invite other folks to in the comment, if they want to have a question or a comment, to please put it in chat. So maybe just going to Bita, I mean, all just like, you know, this conversation about alternative frameworks is going to become really crucial, because this whole idea of contact tracing and the follow-ups and the roadmap to recovery is going to end up into a massive virtual carceral state. That's what that's basically what we are looking at. So in a sense of this virtual carceral state, through tracing and tracking, what are some of the alternatives that we can be? But I know that the one comment was about bringing in the local, you know, PTA and churches and all that. But anything else that you all suggest from your vantage point as public health folks as well? Bita?
I think without us, like simultaneously, and this is getting back to the comment that Dorothy is making about you know, building as we're taking apart, right? That I think that if we are not in public health actively creating a community health system within the public health system, then we are really reproducing like where we were in like 1967, 1968, right? After every uprising where they go and they do some sort of analysis and they come out like people are upset because they don't have the basics. And one of these basics is healthcare. And one of these basics is access to services that, like, outside of like us thinking through how to develop a community health system, then we'll be given things that are not connected, and then don't challenge them, like kind of the segregated health system that we already have of some sort of private that determines the strength of the public, right? Of which then we know is very racialized in terms of who has access to it. Because this whole thing about, like, you know, the idea that if, you know, when if contact tracing kind of takes its most ugliest form, right? Like that we're making a very educated guess about, right? That like a historically based, you know, prediction about that, like if that goes into effect, of course that's not going to be unevenly distributed. We've already, I mean, all the data is already coming out to say people who telecommute, people who work this kind of job, people who are doing this, people who live exposed to this environment, people, like all the data is already showing that like this is something so organized around advantage and disadvantage that when it goes in, if it goes into this version, it's also not going to be evenly impacted, right? And so anyways, when you think about that then, and then you think about how contact tracing is essentially a tool, and that, like, you know, and getting back to the data abolition conversation that we were having about what is the role of data. If data can be used in service of liberation, then we're not going to challenge that data, right? Like, it, you know, to a large extent, we're going to be like, hey, we need to know that. So if contact tracing then falls within that, if it can somehow help us, if we can do it in such a way, have a people's contact tracing, whatever that is, right? And locate it within a community health system, that also then corrects for the fact that people have not been getting treatment at this time. People have, like, you know, all the things that in the education system, all these systems about technology and access to care, like people are not getting treatment for the issues that they've already had, right? Or because they're not getting treatment, now they're having new issues, right? Or worse outcomes than the ones that they have. Like, in another world, we would never have put contact tracing outside of treatment. We never would have like done that. We would have like put it through a community health system. So many stuff would have been taken together, and we would have been like in April being like, well, we did that, we had that, we knew the people, we knew how they were trained, we had confidence in this, and we know that what the goal was because of how they value, themselves, because essentially people would be running it for themselves, right, in a community health system model. So I think that anything short of us really pushing for a community health system, multiple versions of it, like throughout different areas, from a perspective of self-determination, not personal responsibility, right? Then we are like, we're at risk. Contact tracing introduces a lot of vulnerabilities for us.
Jamie, were you gonna say something?
Oh, no, I just want to.
Oh, gotcha.
Want to be unmuted.
Gotcha.
Yeah, if I could.
Sure, please.
So I think this is such an important conversation, because of what we were saying, that it's a way of developing and showing a radically different approach to, a real issue, which is the possibility that people will be infected and get sick, so that's a reality, but how to address that in a radically different way. And I guess I'm also thinking, even the idea of contact tracing, like maybe that is, I would want to investigate critically even that concept, that framework. Like maybe there's a completely different framework. I mean, Bita already said that one difference is you wouldn't have this process without the care that's needed for people. So already that's a radically different framework. But I would encourage you to even think more critically about the very concept of contact tracing itself. Like not just, we'll do contact tracing differently, but maybe you don't even want to think about it in that way. Again, I would think about what is it we're trying to do? Like, what do we need to do to keep people healthy and safe? And how would we go about that? Like, let's forget about how, the city of Los Angeles is going to go about it. Because sometimes there's something that's just fundamentally wrong with a framework. It's like there's something fundamentally wrong with policing, and we can't fix it. We need something completely different. Maybe contact tracing is something like that. I don't know, because again, I'm not in public health. You're actually encouraging me to look more into it than I have, and how you would do that. But there's just so many things about medicine and just any system in the US that's, emerges out of these oppressive ways of thinking, that I think you usually have to not just think about an alternative, but really a fundamental rethinking of the concept itself. You know what I mean? And I don't know what more to say, because something is just telling me that contact tracing itself, right, has certain elements to it that need to be radically reworked, rejected, revisioned, that I think, again, going back to Jamie, what I was saying with you is, that doing that changes the narrative. And if people can see that actually is a better way of being safe and healthy than the way that the city wants to go about it. I think that helps to change the narrative itself.
And I think you raise a really good point, because in what would happen as, say I'm sick, I call every single person I was out marching with, I was at work with, and I'm building relationships of people who will be concerned if I have what I need, to house me if I'm not housed, to feed me if I'm not being fed, to give me clothing, to check on me. And I actually did take the contact tracing course through Johns Hopkins, a few of us did. And everything was assumed that you would have all these things. The contact tracer assumed you would have a home, assumed you would have food. And the only issue and they would just escalate you if you, for some reason, didn't want to comply. Oh, okay, we'll just escalate this to my supervisor now. Nothing else was even hinted at as being a possibility of an issue. And I think, going to Bita's point, it's almost reminds me of algorithms that try to help place people into homes or into shelters based on their risk, or their vulnerability factors. There's nothing on the other side of the algorithm. There is no home. There's no shelter. There's nothing. So why are we even doing it? Because it's just collecting data for no resource to receive in the end.
Yes, or a more devious is those resources don't exist, therefore we need to put that person in jail or detention or punish them in some way. I mean, that's a lot of the way that the family regulation system works, which is we'll look and see all the things this family needs, and we got to take their kids away from them because we have no way of, I mean, literally, that's what just some judges say. I've been in these hearings where the Department of Children and Family Services or whatever, saying, these are all the things going on in the home. They don't have heat. There's a roach infestation. There are not enough rooms. There are not enough beds, and then the judge says, okay, well, we'll keep the kids in foster care for longer. And you want to say, well, I've gone to that with students, when the students have said, well, why not just give them what they need? Why is the answer to take the children away? And judges say, I have no jurisdiction of that. There's nothing I can do about it. My jurisdiction only allows me to keep the children in foster care or return them to a situation where they're going to be harmed because of the living conditions. I don't have any, who am I going to get to give them these things? I can't do that. But that's the way it's set up. And so I think you're absolutely right that, you do this tracing, you do this identification, and you don't have what people need at the end. But I think sometimes it's even worse than not doing anything. It's okay. These are dangerous people. These are bio threats. These are, we got
and especially in the context of protest.
And creating another class of the undesirables. So let me just go to, somebody has a question. So I'm going to Nina Harava. Please go ahead and unmute yourself, Nina. Nina, can you?
Hi, my name is Nina Harawa. I think I was asking, and you, Jamie, mentioned the idea of an ecology of data, or I'm sorry, a predictive data or something around that. So I'd love to hear a little bit more, because part of my question was, when we were talking about the problems with predictive policing and other types of data mining, I certainly understand the problems that were outlined. At the same time, I have trouble believing that where our society is, that we would move away from those types of any type of data-driven approaches, because there's been such an investment in that sort of technology and such a buildup of those sort of sectors. And it seems to me, if you started in a different place, you could potentially think about an anti-racist approach to delivering resources, to sanctioning institutions that were systematically racist, to any number of different things. And I'm just wondering, how have you all thought about that? Or is it really the feeling that you just can't do this at all?
Well, I think we created this pop-ed tool, and thanks, Hamid, for putting it up. And this is what we call the algorithmic ecology. And our test model was essentially predpol, because our fight was to dismantle predpol and LAPD's use of predpol. So the whole idea was to decenter the algorithm, because so much attention is always on the algorithm, and kind of looking at the feedback loop that the dirty data goes in, then the dirty data goes out, and LAPD goes out and, you know, does what it does with mission sheets and hotspots and patrols areas to deter crime. You know, that's the claims, and it's you know, it's unbiased, it's location based, it's not going after people, and that's the rhetoric we hear. So on the right hand of the chart, we kind of set up these kind of tiered understandings of how to start to look at the algorithm and not just look at how it's operationalized. So on the bottom is where the community gets impacted, right? And the reason we started to actually go about doing this algorithmic ecology was because when the narrative of the dirty data in, the dirty data out, and this ratchet effect of policing the same area that's always policed didn't ring absolutely true in the Skid Row community. We got all the hotspots for Central Division where the policing of Skid Row, where Skid Row exists within Central Division of LAPD, and Skid Row already has its own police, right? Its own policing units, the Reset program and the Hope team. And, you know, Skid Row residents always talk about seeing police officers every 30 seconds. You know, they see them every moment of their lives. So we expected it to create a huge hotspot right over Skid Row. That was the anticipation based on the analysis, dirty data in, dirty data out. Can you keep it up just one more second, Hamid? Do you mind?
Sure, sorry about that.
Okay, and we didn't see that. What actually ended up happening was that, and I only take a couple more minutes just to say it, is that the hotspots actually quarantined Skid Row. So PredPol was being used in conjunction with other policing programs to actually quarantine Skid Row, right? So there was hotspots circling all of Skid Row. So it led us to think, well, there's something else that's being used here. And so we created this third tier of the institutions that actually started to participate in not only the creation, but the function, the application, and the benefit of the application, right? And so I could go through all of them, but academia is where we find Jeff Brantingham, the DOD, the NIJ, all, you know, funding this research, private investors and developers, you know, because if we think about downtown in Skid Row, the new downtown is where people don't want, you know, people without homes, you know, traveling into. And then the most interesting thing is that Mayor Garcetti in the State of the City address in 2018 basically stated, PredPol was great. It's so amazing. We're going to keep using it. It protects everybody's property. And what we came to find out was that he instructed the Board of Police Commissioner, who was head of a nonprofit in an area that's being gentrified, to take money from PredPol for her nonprofit. So when we say that we, you know, that we try to fix it and try to, and this is the images of the PredPol hotspots, the darkened spot is the new downtown, and Skid Row is right in basically the areas that appear blank, as if there's no police, but we know there to be lots of police. And this was over a year period of hotspots. And then on the other side is the Arts District, where you see more hotspots. And so the point of the chart was to kind of say that the algorithm can't escape. And the very last piece of the chart was on the top. And then the very top, we had the different kinds of ideologies that govern the society we live in. You know, we have capitalism, we have patriarchy, the idea of scientific objectivity, we have white supremacy and settler colonialism. So the algorithm can never exist outside of those things. And our goal should actually be to dismantle those while we are dismantling the institutions that serve these ideas and that essentially will always influence this algorithm. And it's hard conceptually to think about all these things separately when they move so much in conjunction. And granted, I'm not a data scientist, and I'm not someone that, you know, that necessarily gets into the ins and outs of it, but that's the component of it that, and the coalition, we have a very hard time seeing something being able to overcome all of that, where we have to dismantle those things. So if the tool is being used, and I loved how we talked about data in the very beginning, is that if the tool is being used to expose patriarchy, white supremacy, settler colonialism, and to dismantle it, then the tool can be used to do that. But if it's kind of trying to compensate for it and maybe try to say it cannot be, you know, that it cannot be those things, then I think maybe we're running into a different problem, because I really appreciated that analysis of using data to expose, you know, or using like data around race to actually expose race as not being a true category, you know? And so I started thinking about that in the concept of where we're going when we're thinking about data abolition and how to use it, because it's been something that's very difficult. I use data every day in my life as a nurse. But so what are we trying to dismantle? So I mean, I guess my point is if the algorithm is being used to dismantle white supremacy and settler colonialism and all those things, and you know, maybe it's something that's worth using.
Thank you, Jamie. Bita, you wanted to make some comments about contact tracing, please.
I do, and I'm in like Fatal Inventions, you talk so much about how like the biological determinism goes hand in hand with biomedical solutions, right? So I think for us coming together at the beginning around this, like literally this, like, what is this contact tracing? What is this immunity passports? You know, and like what's going on, like, and this nervousness also comes from the idea that like as a tool of public health surveillance, and there is a modern public health surveillance, which is something very specific, that this is a tool within. As a tool within that, it is structured around this. There's groups of people that are disease free and groups of people that are disease full and groups of people that are like potentially disease transmitting and they don't even know it, right? And so that like, how are we now going to organize people around this is something that we were obviously very concerned about, and its connections, you know, to race and racism. But also that it was like the most easiest place for a techno solution at this time of the pandemic. Once again, meeting like that, like, okay, like as long as we can get like a drug or a vaccine, which is not to say that they're not important, especially when you have things that are novel, right? Like, you know, new infections in society, not to undermine like the importance of those technologies, right? In those ways, but that how much those get weighted to actually changing the system. And another system being in place that like, can reconfigure the relationships of care. And I think that that's where we are, because we've up till now, what is it? This series is in part 13, right? Like in the 13 episodes, we're like, so this contact tracing still, like carrying it around like as the child that we know is in the family, but we don't know what to do with it, right? Because all the even cultures in place have caused so much collateral consequences, right? Like things of which, like in the Cuban healthcare model, contact tracing, not a big deal, right? Like in other parts of the world, not a big deal. Like without being on the ground to know how it really plays out, it doesn't have the same kind of look and feel and nervousness here. We really appreciate to continue to be in conversation about this, and then and thinking through then like modern, for example, public health surveillance having such Cold War ties, right? For it to get the power that it has and to expand, within just the state, being so connected to the idea that there's an other that could at any time put us at risk, right? Like us being like the nation, not thinking that your own healthcare system like is what has you at risk, right? Your own public health system is probably the most riskiest thing to you, and not some fear of some bioterrorist or whatever.
Thank you, Bita. You almost kind of answered a question that was there, that if is contact tracing a tool to hold the carriers accountable in the legal justice system? So, I mean, this is
yeah.
Go ahead, Dorothy.
Well, I was just going to say that could be, similar to what I was saying in response to Jamie, that, identifying people who are at risk or risky, people who are risky without having any kind of way of fulfilling their needs or addressing their vulnerabilities just leaves them as risky people. And you know, we've been talking about this whole time about the way in which people deemed to be risky have been subjected to all sorts of violences. So I think it really is violence, including prosecutions, including being subject to all, you know, detention, and again, going back to eugenics, you know, sterilization in that case. I mean, it will differ depending on the era, but I think history tells us that we need to be concerned about that.
Absolutely.
And I hope you will send me your plan, your new framework.
We will absolutely
together. But I mean, it's so. Okay, so I'll just end with this. It's just so important for so many reasons, because we can predict based on history that it can be used as a form of identifying people to target for punishment and more surveillance and control. And so we should be concerned about that, at the same time that we should be concerned about what it's not doing, which is helping people
absolutely
who themselves are vulnerable to illness, and also that they will increase the vulnerability of people around them, which we should be concerned about. And so then that leads to coming up with some radically different way of addressing it, which can be both a way of creating a broader approach, a broader framework.
Absolutely. And Dorothy, you can be rest assured that there's a Google Doc in people's mind right now with you on it, and to help us walk with us in this thing, because because we are always in this collective journey. It's always in this knowledge exchange. It's always building power. It's always about self-defense, because, like, you know, this is, and it comes from these conversations. It comes from this table, from these spaces. Like, you know, like when earlier we were talking about like having a seat at the table, we're like, no, that table we want to destroy. We want to dismantle and break the legs of that table, because we want to create our own table. And we are creating that table in the streets. We are creating that table in these conversations. So you be rest assured that you ain't going nowhere, sister. We're coming to you, and definitely seeking out, because we want to build this, absolutely, and we are looking at it. So folks, thank you so much. This has been phenomenal. I just want to make a quick announcement from Media Justice and our comrade James Kilgore that this coming Tuesday on the 23rd at noon, there's a webinar titled Decarceration, and the Attacks on Black Lives, Electronic Monitoring, COVID, and the Surveillance State. And our very own Jamie Garcia is going to be one of the speakers as well. So please go look for this. The thing, it's james@mediajustice.org, or look for Media Justice, and it's going to be next Tuesday, which also then it's going to be a busy day for you all, because you do that webinar at noon and come back at 6 o'clock to the Stop LAPD Spying Coalition webinar, because we are now in this mode of going after the LAPD's this bogus notion of data-driven, community-informed policing. Like, you know, check this out. Like, who would have thunk that this is where we are going, which is nothing but a milkshaker in putting in broken windows policing, suspicious activity reporting program, predictive policing, and kind of coming up with this thing. So yeah. And I think lastly, I would say is that the fight is on. Things are popping out there. Our city council members are as, you know, I mean, I don't even know how to watch my language over here. So we got to really call their shit out. We have Marquise Dawson and Joe Buscaino, who are pushing for community safety partnerships, which is a very much counterinsurgency program. It's about surveillance of the communities. They are pushing this bogus notion of community policing, which has its roots in occupation and in Vietnam and in Iraq and Afghanistan. So please, let's be very vigilant, because defunding is like a process towards in our long-term journey of abolition. That how do we make policing irrelevant in our lives? That's really the goal long-term, and how do we abolish this? So thank you again very much. Thank you so much to Dorothy. This is such an honor. Bita, Jamie, Shakir, Mina, everybody else. Awesome, awesome, awesome.
Thank
So we'll
you.
see you next time. Thank you very much. Have a good night and be safe. Appreciate it.
Thank you so much.
Oh, you're inspiring.
So are you.
Thank you.
Take care. Bye-bye.